These are avoidable deaths, sometimes at the prime of people's lives. Young people die every day.
Alcohol is linked to a lot of different kinds of diseases. Overall, more than 200 types of disease and injury. If you take away the alcohol, those diseases would not happen, those deaths could be avoided.
We're concerned about the impact of alcohol misuse across the whole of society. We know that alcohol misuse impacts not just on health, but of course on family life, on communities and on the economy.
Rising global alcohol consumption is a growing threat to health and well-being in most regions of the world.
There are two dimensions of alcohol which are related to health harm, and not only health harm, also social harm. One is the level of drinking. The more you drink, the higher the risk of diseases and the higher the risk to die of those diseases. The second dimension, which is harmfully impacting on health, is irregular heavy drinking occasions.
Alcohol is consumed almost everywhere, but drinking patterns vary. The highest levels of consumption are found in developed countries, where drinking alcohol is the norm for many people. The European region, home to 15% of the world's population, drinks more than 25% of the total recorded alcohol consumed worldwide. Elsewhere, average consumption is lower, mainly due to the high number of abstainers in many countries. However, low population consumption can sometimes mask high levels of risky drinking. In India, where 70% of the population doesn't drink, the amount of alcohol consumed per drinker is double that of the UK. The most destructive drinking patterns overall are seen in Eastern Europe.
3 Baltic countries, Estonia, Latvia and Lithuania, all know very well what binge drinking means. On one hand, we belong to this northern European region, where drinking in excess in order to get drunk is very common. On the other hand, we belong to this Eastern European part, where alcohol consumption nowadays is the highest in the world, and of course alcohol-related harm with it.
As might be expected, the European region has the highest death rates due to alcohol, although this is almost entirely driven by the situation in Eastern Europe. In most high-income European countries, alcohol use causes more disability than death. In general, however, low-income countries experience higher levels of alcohol harm than high-income countries for the same level of alcohol consumption. Alongside risky drinking practices, limited access to healthcare can aggravate the consequences of alcohol-related conditions. Less safe streets and weakly enforced road safety regulations can lead to worse outcomes for drink driving. In South Africa, 52% of male road traffic accident deaths are linked to drink driving, compared to 4% in Italy.
Like in every part of the world, really, alcohol is a big concern. It's a huge concern in Botswana. And our current president was concerned, as other leaders were concerned, about the abuse and the harmful use of alcohol by the country, or in the country, more especially by young people.
The use of alcoholic beverages has been part of many cultures for millennia, but it's the development of alcohol as a tradable commodity that has done most to spread alcohol consumption worldwide. Free trade agreements, deregulation, and increased global market integration have expanded the production and the supply of alcohol across the globe. In rich and poor countries alike, increased availability, affordability, and marketing of alcoholic beverages has led to increased consumption and harm.
Baltic countries have been famous as the so-called EU3, where alcohol-related injuries, for instance, have been exceptionally high. One of the reasons, of course, is a very easy availability of alcohol. Sweden, one of the strongest alcohol policy countries in European Union, has 3.5 retail shops where hard liquor can be sold per 100,000 inhabitants. In Estonia, per 100,000 people, we have 195 shops where you can buy spirits and any other kind of hard liquor.
Brazil is one of the largest countries in the world, but is perhaps one of the biggest alcohol unregulated markets. We have more than 1.2 million selling points of alcohol without any control. We don't have any license to sell alcohol in Brazil. We have one of the cheapest alcohol drinking in the world. I mean, a bottle of beer is cheaper than a bottle of milk.
The Thai people can be easy to buy the alcohol beverage. We have the 500,000 license to sell. Unfortunately, the alcohol industry are very high profit and high power. Then the law enforcement are not active. So youth and women are the target of the alcohol industry.
With young and growing populations, a high number of abstainers, particularly among women, and rising disposable incomes, developing countries offer the potential of huge growth and profitability for the global alcohol industry.
The alcohol industry spends more than $1 billion South African rands advertising alcohol to South African consumers, and the main reason for this really is because almost 50% of our population does not consume alcohol currently, so they would have a huge increase in consumption if they could convince more South Africans to drink alcohol.
Rising global alcohol consumption has consequences beyond health. It is an obstacle to sustainable development. Improving health and prosperity for all depends on action being taken to reduce alcohol consumption and to protect non-drinkers from pressures to drink.
Abstinence on a cultural level is the key, the biggest key to alcohol-related health harm in the world. Currently, we are having 3.3 million deaths associated with alcohol. If we were to increase the number of drinkers, this number would easily go way beyond 4 million, 5 million, even 6 million if everybody starts drinking. What we need to do is keep abstention a normal option which everybody can choose from.
Fortunately, it seems the world is waking up to the problem of increasing alcohol use. In 2010, the World Health Assembly endorsed the first global strategy on alcohol. Successful implementation of the global strategy requires sustained commitment and leadership. There are practical and political challenges to overcome. In South Africa, commercial interests have put up strong resistance to the introduction of a government bill to ban alcohol marketing. In other countries, there has been some progress. But worldwide, there remains a great deal to be done.
Effective interventions for decreasing the harms because of alcohol require a multi-sectoral involvement. Not only the Ministry of Health, but many other ministries need to come together to make the national strategy to reduce the harm because of alcohol. In addition, civil society has to play a very large role in increasing the awareness because of harm of alcohol, as well as to track this in countries so that they can put a mirror in front of the society and in front of the government to say, how are we dealing with alcohol related harms?
One of the most radical measures that was put in place was the introduction of the alcohol levy. It was first introduced at 30% levied on the alcoholic beverages, and through the years we've seen an increase to the levy which now stands at 55%.
Our alcohol strategy contains over 40 measures focused very much on tackling the availability and affordability of alcohol. And of course, one of the key measures that we want to take forward is minimum unit pricing to tackle affordability, because we know that the biggest harm comes from those high volume, cheap alcohol products that are so widely available in our society.
Last year, Estonian government adopted an alcohol policy green book. Now we are expecting that the new government is going to fulfill its task and formulate a concrete, comprehensive alcohol strategy in order to introduce these different policy measures. There are plans both to raise taxes, to restrict availability, and also to restrict alcohol advertising.
The draft bill was ready in 2012, and ever since then the alcohol industry has come up with one or other obstruction, and debunking the research that we have, or highlighting falsely the enormous number of jobs that will be lost if the bill is passed. And we've had to constantly fight back just to stand in the same position.
WHO is implementing the global strategy to reduce the harmful use of alcohol quite vigorously in a variety of countries, but we cannot do it alone. We need the help of civil society as well as the government and also researchers to make this a real possibility. But I see the future as being brighter than what it has been earlier because of increasing awareness and increasing commitment by a variety of people.
Research can impact and can tell people which measures to use and which measures not to use. We are currently seeing way more imagination in those policy measures. We are having the debates in several European countries about minimal pricing policies.
Our strategy is very much in line with that of the World Health Organization, and as we take it forward, we are very keen to continue to tackle the availability and the affordability issues around alcohol, particularly through minimum unit pricing.
We also have new, quite innovative taxation measures in different African countries, in Asian countries. And I think what research and monitoring can do is to show those successes, to establish measures as benchmarks for other countries, and to actually help improve the overall alcohol policy to become successful.
I think for me, I'm very optimistic. The reason I'm optimistic is that you have the president driving the whole response. I mean, the fact that he came up with a levy was a bold move on his part, and that annoyed a lot of people, but he went ahead and said, let's do it for the sake of our young people.
We've had public meetings, we've made submissions to government, we've done our own research.
We need the whole of the society approach to tackle this problem. Within the ministries, there should be enough dialogue, enough communication to see to it that a good balance is arrived at and health is kept at the top of the policy making agenda. That's exactly what we need.
It's not an event, it will happen over time. So I think it's for us to keep on stepping or putting the foot on the pedal, on the gas pedal, and ensuring that we go ahead and do the right things.